Welcome, parents, or providers, educators. We are going to start diving into this workshop that we call the Perfect Storm and really just dive into why we are seeing so many kids struggle, why our kids are struggling, and what we can do, what you can do as a parent, as an educator, as a provider to really help best support these kids going forward, and not just kids that are having deeper challenges, but really also just helping understand that we all live our lives through our nervous system, and we need to make sure that that nervous system is functioning at its best. Now, this perfect storm that we're going to talk about, we are going to dive deep into some of these things that nobody's talking about and connecting the dots to these challenges that are going on. And again, really getting down to the root cause or causes of why these things are happening. So, if you are a parent that has done everything under, just like everything out there, and you just feel like we're not building momentum, you're not seeing the change, you see some improvement, but then you hit another roadblock, and then you just got to throw something else at it, and it's just this constant challenge or struggle. You are in the right place. We talk about how really health is like a puzzle. And a lot of times we're doing the right piece, where we have the right pieces to the puzzle. We just are missing a piece. And really, or, we've been doing all the right things, but we're just doing them in the wrong order. Because again, that's how the body, when we look at just how the body, the brain, the nervous system develop, it all is in sequence of a specific order. And that's how we also want to approach things when it comes to our healing. Okay. So I completely dived into this without really introducing myself. I'm Dr. Eric from ADIO Chiropractic. I am one of the pediatric chiropractors here, and we are a neurologically based chiropractic office, and we help really dive deep into helping parents uncover and really come up with a game plan of really best supporting their families going forward in their health journey. Now, just kind of diving into this, and answering kind of this, just odd question of why is a chiropractor talking about, behavioral learning, socialization challenges, autism, ADHD, and, aren't they great with back pain, neck pain, but isn't that really the extent? We'll dive into that more, but like, let's just answer that very quickly here. We are do things differently here in our office. Like I said, we are a neurologically based chiropractic office. Our goal is not to just put a bone back into place. Our goal is to improve the way that our nervous system is communicating to and from our brain. Okay, our brain is constantly taking in information through our nervous system, processing that, and then spitting out information to function appropriately. But if that nervous system isn't functioning or has what we call subluxation, alteration on it, it is going to interfere in the way that that brain is processing, engaging, interacting with its world. And that can result into behavioral learning, socialization challenges, developmental delays, all of these things that we are seeing so many kids deal with. So that is why I'm having this conversation with you guys. And no further, let's just dive into things. So, first thing I'd like to just kind of talk about is what are the approaches out there? Because most people think of, kind of these two routes that they can go, two options that they have. This first one, which is traditional medical, which is, hey, here's a pill, for things, or here's these therapies that, you need to have your kid in. And there's times and places for it, definitely. As just to give you a little bit of history on my growing up, I was a kid that was diagnosed with ADHD. I was put on Ritalin, then moved to Adderall. I dealt with a lot of behavioral hyperactivity, focus issues, anxiety. And I know this world so much because I lived it majority of my life. And it played a part into, getting me through the day, but it wasn't at the end of the day it wasn't addressing the root cause of why I had those challenges in the first place. The second option that parents are starting to become a lot more familiar with is the functional med route. And that is more holistic, natural supplementation, a lot of getting into, testing for infections, things like that, which, definitely is a vital part into this journey as well. There is never just one piece that we need to navigate. Sometimes there is multiple pieces to this puzzle that we need to integrate or incorporate in this healing journey of our kids and our family. But the third option that really nobody's talking about, that we are so passionate about getting out there to families like yours, is neurologically based chiropractic care. It is, just a piece that tends to get overlooked, but is the foundation to how our bodies work. Our nervous system is the air traffic controller of how everything in our body works. So we need to make sure that that nervous system is functioning appropriately. And, neurologically based chiropractic care addresses that from the source, which is the spinal cord, and really making sure that that nervous system is functioning properly. So we'll dive more into that as we progress through, but just know that there are three options out there, and sometimes we do need to incorporate all three of those into our kids or our family's health journey. So let's gonna watch a very quick video here. So a couple things that we're going to talk about in this video, in this workshop, in this webinar is what we call this moonwalking bear. Okay. So let's just watch this.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Be honest, who ended up not seeing it first, but here we're replaying it. So on the right side of the screen, now you can see in the middle. So the point of this video is, and this is, we'll get into some of these things, but it's easy to miss something that you're not looking for, okay? Some of these things that we're going to talk about in this webinar is this moonwalking bear. It happens every single day in our world, but we're not connecting the dots to that and these things that are going on with our kids. So what is the perfect storm? Okay. There is, we see a lot of times in our practice, this sequence of events that occurs that these kids go on this journey. And not that they're going to go through every single part of this sequence, but it's very common that we see, majority of these things kind of going on, or at some point along their journey, they've gone through these. So first starting, reason that we do a very detailed case history is because more and more research is coming out of how birth or how pregnancy and stress during pregnancy can start to create these changes within baby's nervous system, because the nervous system is the very first thing that starts to develop in utero for that baby. And it's that baby's nervous system is starting to um, grow and develop and perceive its environment based on mom's nervous system. And I want to address this before because a lot of times we get into this shaming world, and that is not what any point of what I'm going to be talking about is. I'm trying to get across here. I am not trying to shame anyone. That I am just trying to help educate parents out there that you know there are things out there that come with more stresses and that we are seeing more links to, because it really just helps us really just uncover what has this child been through that has gotten them to this point. Because if things started in utero, it just tells us that a lot of these things been going on majority of their life, and it may take more time, versus something that maybe just started, 3 weeks ago. And I'm not talking about just the symptom came 3 weeks ago, but just the underlining causes and this perfect storm started to brew very early on in life. So we get into this, significant mental and emotional stress that we see during the prenatal period. And most, I would say it's probably been obvious, but we definitely seen a significant increase of stressed out babies since 2020. Since the COVID issue thing started, where stress went significantly through the roof for our moms, especially our pregnant moms, because mom was more stressed, anxious, overwhelmed, and that was just creating this cascade already deepening within that baby's nervous system before they even took their first breath. But even before 2020, there's still so much stress, physical, chemical, emotional stress in our world that was creating our pregnant moms to be in this more emotional and mental, physically stressed out state. So, and then we get into medical interventions at labor and delivery, things like induction, C-section, forceps, vacuum extraction. We're finding again from research, there's so much research that's coming out that, birth interventions are creating an increased risk of a lot of these challenges when it comes to asthma, allergies, um, getting into more behavioral learning, socialization challenges, because of the actual stress, physical stress, and sometimes the emotional and chemical stresses that that baby went through. Even a perfect vaginal birth comes with physical stress. But when we utilize these interventions, it comes with more stress. And I get that there is times when they are medically necessary. And again, at times we have to go through those. But even though in those situations when we do, it's medically emergent, it still comes with those stresses. Okay. And this is going to be one of those, and I'll dive a little bit deeper into this in a little bit, but this is one of those moonwalking bears. Like I said, everyone is being brought into this world through delivery, but you know, with especially in today's world, it's creating in conjunction with all the other physical, chemical, and emotional stresses that our kids are going through. This is something that we need to be a lot more aware of and start to address these things very early on in life. But what happens is we start to see that now because of maybe some emotional, stresses during pregnancy, the delivery process, we're seeing, maybe a stressed out, colicky, constipated baby, one that can't sleep. And babies are meant to do three things: eat, sleep, and poop. And if they can't do one or two or all three of those, that is a, red flag that there is stress on their system and their body is overwhelmed. And, what we hear so often, from parents is that, they had taken them to the pediatrician and the pediatrician just said, don't worry, they will grow out of these things. And, I think that is one of the biggest lies that as parents are being told, because they don't grow out of these challenges, when they're little. The symptom may go away, but the stress that created it in the first place is still there. It's gotten deeper. And I don't see a colicky 3-year-old, but I see a kid that now may be dealing with chronic immune challenges or still dealing with some gut issues, or now we're getting into more emotional dysregulation, behavioral issues. And we might see developmental delays, all of these things starting to come up because they grow into deeper challenges like, sensory and sick and challenging toddlers, right? And there's this borderline of what's ideal versus what's not. And we'll get into how we don't guess in our office. We want to measure the function. We're not here to just go off of symptoms. Symptoms are part of the picture. They're the check engine light of our car. But the check engine light doesn't actually tell us what's going on. We have to then do some CSI and really dive deeper into that. But, kind of building onto the sequence of things is that, then we have that sensory, constantly sick, challenging toddler, who then, the use of antibiotics and infants and children under the age of 3 can significantly increase the rates of allergies and asthma 2 to 4-fold. Studies are showing. So again, sometimes definitely antibiotics are needed, but I think they definitely are over prescribed, because they feel like they have to do something. But sometimes it's best to just let the body do what it needs to do instead of just throwing antibiotics. But usually, as they get older, what we start to see then is we start to see deeper sensory issues. We start to see more things on the spectrum, hyperactivity, this emotionally stuck child. When we just look at statistics, rates of autism has tripled since the year 2000, now affecting 1 in 44 children. Some places I think you can see 1 in 36 kids. That is crazy. Just how much that has increased. And, it isn't just because we're getting better diagnosed. That does not play a fact that big of a factor in seeing the rates of autism going up. Okay. The rates of ADHD diagnoses in kids have soared 67% just in the last 20 years, with 3.5 million. Again, 3.5 million US kids on ADHD medications. These are heavy drugs, that our kids are being put on, because we're being told that this is the only way to go when it comes to ADHD. And that is not true. Then we get, older into teenagers, and then we start to see, instead of this hyperactivity, we start to see this exhausted, angry, anxious, depressed teenager. And when we just look at statistics there, rates of anxiety in teens, had already surpassed adults and reached 1 out of 3. 1 out of 3 teens are diagnosed with anxiety. And then they rose again, during the COVID released related lockdowns. Again, this stress significantly increased during that time, and we saw more anxiety within our teenagers. And it doesn't just stop at teenagers, it gets into the adults as well. How many adults out there, and maybe yourself, are burnt out, stressed out, anxious, maybe even just ADHD adults yourself, right? And it just continues this cascade until we address and peel back the layers and get down to everything below the surface of the water of the iceberg, so we can really start to chip away at some of the root cause of why these things are going on in the first place. Just because they are so prevalent and so common does not make them normal. So one thing talk a lot about with our patients in our office is this gas versus brake analogy. Okay. What we know, and kind of talking about this a little bit already, is that the more stress that they face, so the physical, chemical, and emotional stresses, the more that they face, and the earlier on that they face it, the more it starts to rev this engine into what we call this sympathetic fight and flight state. That is that gas pedal. So we get stuck on the gas pedal. So we're going at 100 miles an hour, and we're only going to be able to last there for so long before over time we start to see this exhaustion within the nervous system. Okay, where then we get into the teen stages and we get into that exhaustion, anxiety, anxious, depressed states, right? But I think we all can agree, and not even just in the last 4 years, but just in last 10, 15 years, the amount of stresses that our kids are going through have significantly increased. The amount of physical, chemical, emotional stresses. So we talk about the 3 T's: traumas, toxins, thoughts. Okay. And honestly, I would add a fourth T in there, and that is technology. Those 4 stressors are so much more prevalent early on in our kids' lives than ever before, and it is creating this drastic shift quicker than ever into an overwhelmed, stressed out state neurologically. And that then alters the way that that brain moves through development. So, famous PhD cell biologist, Dr. Bruce Lipton, he quoted this term, he came up with this. He said, the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. Now, most parents, most people get caught on the word behavior because we are most likely joining this webinar because of behaviors. So why not get caught on the word behavior? But we have to backtrack some of that. It says the function of the nervous system is to perceive. We have to perceive, take in, process this information about what's happening in our environment. Then the brain has to coordinate that information and then spit out a behavior or an action to organs, glands, tissues, or actions, in visual behavior. Okay. So the behavior is the result of the perception. So if our nervous system can't perceive our environment appropriately, it is going to alter the behavior, the end. So we have to look at how is our nervous system perceiving things before we look at behaviors. Behaviors are just a window into what's going on within the brain and nervous system. So getting into some of this perception stuff. So altered perception is what you'll hear me sometimes, well, you'll hear us say, and that is subluxation. Altered perception, so altered sensory input to the brain is what we call subluxation, and that equals altered function. Okay. Now, I'm going to kind of go in the order of how our perception, how we move through some of these developmental milestones. One of the very first, sensory perception is motor, neuromotor. Okay. Movement dictates function. Okay. And I'm not talking about just skeletal muscles. So like, our big muscles, our organs, our glands, our tissues, those are all surrounded by motor muscle. More smooth muscle than skeletal muscle, but it's all motor. So neuromotor function dictates everything else. Then we start to see the gut, neural gut system come on, the neuroimmune system, the neural speech centers, the neurosocial, the neurobehavioral, neuroemotional. All of those are dictated by the function of our neuromotor system. Because brains, when we look at how the brain develops, it develops from bottom up, back to front over a period of time. Okay. So if, like we're building a house, if we're building a house and we're skipping some crucial layers of that foundation, we can still get potentially a house built, but how stable is that foundation if we skipped or if we had alterations in some of those very early developmental milestones or functions of the brain. So, this is, this part here, when the neuromotor system is altered, everything else is altered. We have to start with that neuromotor function and start to then why we start to see, hey, the gut starting to come back on board, the immune system, the motor, the speech part, motor function, the social emotional centers start to come back on board once we start to address that neuromotor function. So getting into kind of this hierarchy. So the hierarchy of neurological health and healing has 3 simple steps in the sequence. Autonomic nervous system first. Okay. That is a huge part of what we focus on here. We need to get that autonomic nervous system. Think of autonomic as everything that works automatically of that nervous system that controls every single organ, gland, cell, tissue in our body. Okay. Then that motor system second, and then the gut immune organs system third. Okay. It is all about this sequence. These things tend to happen in a particular order, and we need to address these things in this particular order as well. So Harvard school, they have a Harvard Developing Child Discussion Board, and they couple things from that they concluded and discussed and came up with is the interaction of genes and experiences, our environment, shape the developing brain. The interaction of our genes, so it isn't just genes, it's how our environment and our genes interact. It's what we call epigenetics. That is what shapes the developing brain. So although genes provide the blueprint for the formation of brain circuits, these circuits are reinforced by repetitive use. Okay, the nerves that wire together, or nerves that fire together, wire together. Okay, so we have to look to their environment and the way that they're perceiving their environment going forward. So another thing was cognitive, emotional, and social capacities are intrinsically intertwined through the life course. Okay. Just meaning that through those experiences, through our environment, that can have, huge impacts on our cognitive, emotional, and social compatibilities. Um, so they did a lot on toxic stress. Now, obviously, I talk about, combination of the physical, chemical, and emotional. So they kind of get into that chemical aspect. But they said toxic stress weakens the architecture of the developing brain, which can lead to lifelong problems in learning, behavioral, physical, and mental health. What? And the thing is, obviously, like I said, they focused on toxic now or chemical stresses. The our bodies don't know the difference between physical, chemical, and emotional stress. On the outside, we do. We know the difference, but internally, our nervous system responds the exact same way to a physical, chemical, and emotional stress. Okay. So, this is from Harvard. They're already showing that toxic stress, chemical stresses, weakens the architecture of the developing brain, which can lead to lifelong problems, learning, behavioral, physical, and mental health. This is huge. And we need to then address what these stresses are doing and how can we change the function of that nervous system and brain. Um, so just briefly on here, on this left side, you can see there's a couple of colored lines here. The yellow is our sensory pathways, blue is language, and then red is cognitive function. So on the bottom, it's based on months and years. So you can see this trajectory of when, our sensory pathways really start to take off within few months of life to language then starting to take off a little bit later and then higher cognitive function. So, these things, when we look at it from a symptomatic aspect, you know, um, we might have some language things that are going on. We might not be verbal and we just hammer verbal language. But if earlier on pathways are altered, we have to address those first because it's all about building that brain from back or bottom up, back to front. Okay. So we kind of have this algorithm that we really assess when we analyze and when we dive deep into the history, into the scans. One of the first things we look at is how much stress. So out of the three T's, the toxins, the traumas, the thoughts, and again, fourth T, technology, how much stress has been in their life, not just now, but if they're 12, what what have they been through from, all the way from pregnancy all the way up to now? Because it's those things that happened 9 years ago played a role into all of these things. It's not that it happened and it just goes away. All of this, we might not remember it, but our nervous system, our body remembers all of these things and it accumulates. Now, when did the stress occur? Again, that's why we do a very detailed case history. Did we start to see that these things started to occur very early on in life? We know from taking these histories, over the years that there are some key things that we see that are key pushers of making this shift very early on life, even if we didn't have symptoms right away. And when we then assess those things, it helps us really then look at how much care is needed and for how long do we need to help to restore that neurological balance. Our goal here is not to treat a symptom, but is to get that nervous system in a balanced state neurologically so that that nervous system can start to perceive its environment more appropriately and start to engage, interact, and process its world more appropriately. And what we see so often is these behaviorals, these challenges start to significantly improve, or when we start to incorporate therapies, again, then they start to take off a lot more because the nervous system is in a more balanced state. Again, nervous system controls everything. So, um, so this is a quote from Dr. Tony Ebel. He is one of my mentors in this realm of nervous system based chiropractic care. But he says the spine serves far more than a bunch of ligaments and bones. It is a living, breathing, neurological communication superhighway that is vitally important to the brain, to body, and back again. Communication, coordination, and control of every other tissue, cell, system of the biological and physiological system. You can read through that again. It is the key foundation to how our body and how our brain develops. But again, because we don't see it every day, we don't think to address it. So again, here's that word that you saw come up earlier, and I mentioned a little bit, this word subluxation, okay? Subluxation, when you hear me say the word subluxation, I want you to just think stress stuck on. The nervous system is stuck in stress, and we need to get that nervous system balanced, okay? So we're going to get into some of these. I'm going to dive a little bit into some of these. I'm just going to pull up and very briefly talk about. But we talk about these 5Ds, and they happen in kind of this sequence of things. So dyskinesia, this is what most people associate with chiropractic, this abnormal alignment and movement. Okay. And this is where so many chiropractors just stop. They address movement. And that is part of the picture, but it starts this cascade in the sequence. So we have dyskinesia, which is abnormal movement. Okay. Then we get into disafferentation. Abnormal, afferentation, sensory input. Okay, so abnormal sensory input. If we have altered movement, we alter the way that our brain is receiving that neuro movement, that neuromotor input. Then we get into dysautonomia. Okay, abnormal, autonomia, autonomic function, abnormal function of the autonomic nervous system. So we start to see this imbalance within this autonomic nervous system that's controlling all of our organs, our glands, our tissues. And when we look at, again, organs, glands, tissues, those are what control and release neurochemicals, hormones. And if the nervous system stressed, that stresses out these organs that then create a stress response and release these stress hormones, stress neurochemicals. Then we get into dysfunction. So now altered output. So this dysfunction, interference of optimal function of other key systems. And why, especially just autism really is, trifecta of all this, but it is a multi-system. Why we see so many people with more than just one thing going on is because the body functions as a whole. So we have abnormal function in one place that can alter the function of other systems in the body. Okay. And then we get dyskinesis, abnormal energy expenditure and output. This is your hyperactive, raging bull kiddo. Just they can't control the amount of stimulation that is going to the brain, and they have to burn it off by just having this out of control, energy expenditure. So how does this dyskinesia start? I talked about, some of this moonwalking bear, right? And So, when it comes to the birth process, now I'm gonna play a video here in just a little bit. If you get lightheaded, queasy, you can, just look away. But I think, the reason I play this is, again, not to shame, do anything like that, is to just come to this realization and this understanding that, we may have, our child may have gone through these, obviously our kid has gone through birth. But these interventions, they happen so often, and it's just another check mark on, their record of, hey, they've gone through C-section, or they had vacuum, or um, you know, forceps utilized, or even just a very traumatic vaginal birth, and it's just kind of put to the side. But because we don't actually see what actually happened during a lot of this, so let's play this video here.
Get irritated. Oh, there you go. Swallow. Come on, buddy. Oh, there it is. Ears of a girl. Ears of a girl. Make you cute for the camera. Coming back.
Okay. So that might have been very hard to watch. And, I've seen this video clip hundreds of times, and it doesn't get easier to watch, but it just drives my passion more of, why we do what we do, because there are so many kids that are being, a third of births, and I'll cover that, but a third of births, in some parts of the country, it's almost half of the births are C-section. But I'm not just here tearing down on C-sections. Vaginal births still come with physical stress. And why it's so important that, we get baby checked at such an early stage, because this kickstarts so much stress within their system. Because, we're told to support the head and neck of a baby when they're first born, because they don't have the control, the motor control of the neck. But then, so if Uncle Johnny came, 12 hours after, baby was born, and picked the baby up from the head, you would never let Uncle Johnny ever pick up your baby again. I think we can all agree on that, right? But the thing is it happened so often in these births, but we're not connecting those dots. And we're here to help connect those dots, because, again, some of these things start so early in life, before they even took their first breath. And again, look at that amount of tension and traction. There is what we call this vagus nerve. It is a cranial nerve. And I think it's gotten a lot of publicity, which, I'm glad it has, because it plays such a huge role. But this vagus nerve exits the skull and travels down the neck, down into the back, and supplies 80% sensory, neurosensory input from our organs, our glands, our tissues. It has so much connection with social, emotional, gut function, neuroimmune function, and so much more that there's uncovering with this. But that vagus nerve branches 1 to 2 centimeters away from the upper part of the neck. Look where this doctor's hand is in the back of the head, right where that vagus nerve is impacting, which then, creates so much stress and traction to that vagus nerve, and then creates this, that vagus nerve controls the parasympathetic part of our nervous system, which is where rest, digestion, growth, development, healing occur. And when that gets impacted, that creates more of a decreased parasympathetic function, and shifts more in this fight and flight protective state. Okay. So our kids are more in a sympathetic fight and flight state, right away at birth. And this is just, an outdated, but this was, looked at it from all the way to 2012. which probably honestly is probably increased somewhat. But again, just showing the amount of our rates of C-sections. This is just some studies here. This is one that was done by osteopaths, which are pretty much just different initials, but like medical doctors. Okay. And what they did was they assessed 100 healthy newborns. So they were healthy, and 99 out of the 100 infants had at least one pattern of what, we call subluxation, what they call somatic dysfunction. Okay. So out of 100 healthy newborns, already 99 out of 100 of them already had altered function to the nervous system. Already it was altering the way they were perceiving their environment. This is just, like I said, there's so much studies coming out, and some of these, you can see 2001, 2004, 2015, there's been a lot of research that earlier years back that have already been showing a lot of what we're talking about today. But we'll get into what we can do to really start to address this. Okay. So I want to talk about this dysautonomia. So this is probably don't hear about this very often, but again, dysautonomia is dysfunction of the autonomic nervous system. This can be a couple of things that we can see here. In the brain is the amygdala, which is the seat of our emotions, specifically fear and anxiety, which is why we're seeing so many connections with the social emotional connections with the vagus nerve, the hippocampus, which is for factual learning and memory, including situal awareness. So again, so many of these things that we see so many kids struggle with, and just told that they're going to grow out of. But if we have this altered function, it really doesn't just go away. And then we get into the prefrontal cortex, which plays a central role in cognitive functions. So again, these higher functioning parts of the brain that then, we get into attention issues or just lack of control, because the prefrontal cortex, when we're more in a state of stress, isn't functioning optimally the way that it should. So again, another quote from Bruce Lipton, you can't be in growth and protection at the same time. We're seeing kids more shift in this fight and flight state, and we're not seeing them move through growth and development at the rate that they should. And we're seeing challenges or behaviors along with this, because again, behaviors are always, let me say that again, behaviors are always a window to the brain. We have to look to the brain and nervous system when there is challenges going on. So, I talked a little bit about the vagus nerve, but again, there's a lot of studies out there that are showing the vagus nerve, and the function of it. And, they're coming out with vagal stimulators that they implant to help stimulate the vagus nerve. Deep breathing can help stimulate it, but those all impact the vagus nerve indirectly. Our specific neurologically based chiropractic care is addressing the vagus nerve at its source. So we're addressing the vagus nerve directly to have the most impact long term on this vagal, on the vagal nerve, on the vagus nerve, and on this balance within the autonomic nervous system. So again, we hear a lot about the gut brain connection, and not going to get into this much, but before there's that gut brain connection, there's this brain, or before gut brain, there's brain gut connection. Vagal nerve stimulation potentially potently reduces intestinal inflammation, restoring intestinal homeostasis. So, again, just showing, in this case, just the importance of the vagal nerve and the function of it autonomically. So I'm going to skip through a couple of these things. Let's get into what we call subluxation and just get into some case histories and things like this. So this is Evan, and on the left is a scan that we do, one of the scans that we do that allow us to measure the function of the autonomic nervous system. Okay. And just to keep this as simple, we go into more detail when we do these histories or when we go over these scans with you guys. But just to keep it very simple, color is not good. Red is not good. We want more white, maybe a little bit of green, but we don't want the reds. We don't want the blues. That is telling us that we have significant amount of inflammation on that autonomic nervous system. So altered function of the autonomic nervous system, dysautonomia. So here's a video of Evan. I just want you to see how he is engaging and interacting with his world, how he's perceiving his environment.
Bye, Aunt Kristen. See you later.
Oh,
No? Did you have fun? Did you have fun? Yes? Yes? Do you love Aunt Kristen? Say yes. Yeah. What? Bye, Aunt Kristen. We'll see you later.
All right, so you can see in here a couple of things. I mean, just how he's perceiving his environment. I mean, I don't know if you could see, but he also had a black eye, horrible balance coordination, always falling. Again, getting into some of that neuromotor component. Getting into, that neuro speech centers, hard for him to process reception. You have to understand what somebody's saying before you have this expressive language, but very delayed with his speech, again with his coordination and balance, and just how he engages with his world. Now, this is Evan a couple months later after getting more neurologically based chiropractic care. And I want you to just see how he is engaging with his world compared to that first video.
Is it a bird? What's that one?
goody.
What is it? A dog?
Yeah, Diane.
Yeah.
A truck.
What's that?
A truck.
A truck?
Fast truck.
Fast truck.
Flash. 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 Oh, flash. Flash is our truck.
What's that one? No, this one. What's this one? A snake.
It again.
Yeah. Oh. Show me what
So one thing that we talk a lot about here is just expecting miracles. And when we start to restore function to how our bodies were designed and to function, we just see these miracles happen because our body is the greatest healer. And that was one thing that was lacking with Evan was he was such in this altered neurological state that he was not in an optimal state to grow and develop. and we were seeing so many of those delays and challenges. When we started to unlock that system, then he was able to perceive his world so much more effectively, and his growth and development started to take off. Their progressions in therapies started to take off because, again, he was able to perceive what they were doing in therapies much more effectively. So it's just, we have to start with the foundational components and build from that. Again, we see these are just a couple examples of some of the different scans. The far left one is thermography, again, allowing us to look at the function within the autonomic nervous system. The second, the middle three are all EMG scans, just different views that we look at, and allows us to look at that neuromotor function. And then the far right one is what we call HRV. It stands for heart rate variability. It allows us to look at the overall capacity from a 30,000-foot viewpoint and how well our body's able to adapt and respond, that resiliency within our nervous system to be able to respond to stresses, physical, chemical, emotional, technological stresses. Okay. Here's another one. So I want you to look at how she is just, supporting, looking at her posture, looking at, just how she engages, because again, this little girl had motor delays, was delayed with walking, and you can just see here, just watch the video.
Are those shoes all better? Come on. Come on, Tegan. You can do it. I believe in you. Please.
Tegan needed to use the wall to really support her because she didn't have that neuromotor control.
I believe in you. You can do this. Yeah. You boy. Yeah. Hey, buddy. Yeah. Yeah.
And then this was video after getting consistent chiropractic care. You can see how just that neuromotor control coming on board, seeing more improved function. Right. So it's just one of those, when we start to improve neurological function, things just start coming back on board the way that they should. Our brain and our nervous system is intelligent and knows what to do, but if it has altered function, it starts to alter that growth and development. And so, we do these scans on all kids of all ages. Usually under the age of 3 or 4, we'll do just the thermography and HRV. 4 and over, usually we're doing those two plus the EMG scan. But you can just see here, again, especially up top here, just very briefly, you can see that significant red bar on the left, and then right on the right, significant red bar on the right as well. So we're seeing a lot of significant counter rotation within that nervous system, that autonomic nervous system, and that's just impacting. Now, this is for this kiddo specifically, what we were seeing was more chronic immune challenges, poor drainage, just ear infection after ear infection, sinus infection after sinus infection, strep, constantly just sick because that nervous system was bombarded and overwhelmed and things weren't draining, which was then leading to increased demand and stress on the neuroimmune system. Again, we're just seeing, just so many, you know, great changes when we start to improve neurological function. But getting into kind of this category, when if we were to kind of categorize some of these scans, and obviously we're not here to diagnose, put a name on any kid. We're here to ultimately restore function to their body, to their nervous system. But what we really start to see with some of these scans, especially with EMG scans, is we get into, combination of things. We'll see either a drunken bull, and this is more those exhausted kiddos where they just have this collapsed posture, just what seems like a weak core, but neuromotor control. Their sensory system is just so exhausted that they don't even have enough to really support that neuromotor control. And then we get into this raging bull, this significantly overstimulated, high-strung, just bouncing off the walls kiddo that just has so much stimulation within their sensory system. Their brain is just receiving so much overwhelm. And then we'll also see a combination of both where, some regions of that neuromotor function is hyper stimulated, so more of that raging bull, but then we'll start to see some of that exhaustion within other regions of that neuromotor sensory system. So, that's where we kind of see three different categories. And when we see that drunken bull, that's probably getting into, honestly, more of those more deeper cases because things have been going on for a longer period of time. So, again, just some things that parents have reported for this one kiddo, before they came in, they had emotional outbursts, sensory processing challenges, separated from regular classes, suspended from school. After starting to get regular neurologically based chiropractic care, started seeing better emotional regulation, all regular educational classes, so wasn't in separate classes, got back into regular classes, ended up being a straight A student, got comfortable in school. And again, it's just when they have this altered neurological function, it alters the way that they're perceiving their environment, and which then alters again how they engage, interact, and process their world. So when we start to restore that function, again, all of these things, we can start to see come back on board. And we see all ages from newborns to teenagers to adults, and it's just awesome to see, all of these changes, no matter what age they are, because the thing is the body, the nervous system can always change. We just need to know what we need to do to change it. And that's why we never guess on anybody's health that comes in. That's why we always scan. So that's why, to conclude this, action steps for you. So first thing I want to say is keep seeking hope, answers, and help. Okay. You watching this webinar just is a reflection of this. You are already doing it. You're seeking out other answers to why these things are going on. So never give up. There's always hope out there. And we would love to be on this journey with you and your family. And that's comes to the second one is until we actually measure the function of the nervous system, we're never going to know. I can get a good idea based on history, but we never just guess. We want to know exactly what's going on. So, scheduling your child's consults, scans, and then report of findings. Okay. I'll get into that just a little bit here, but we have to measure it. Until we know what's going on, we can just assume, but again, we never want to guess on anybody's health. So again, our initial process we break down into 3 appointments. We do a phone consult, and this is where you do a one-on-one history with either me or one of our other docs on the team. Then we set up a scan appointment. This is where we do neurological scans that measure the function of that nervous system. Again, we do up to those 3 different scans. Our scans aren't putting anything in the body. We're not taking anything out. We do them on our newborns. We do them on our pregnant moms. They are completely safe. Once we have that history in those scans, then we really put together a customized care plan that then we sit down at the report of findings and we go over what we found, what we recommend going forward, and then we'll also go over the financial options. Go over all of that, what logistics looks like, scheduling, and all of that, okay? And what I want to do is offer you an opportunity to find out. So by watching this webinar and taking the initiative, if you click on the link that we provided with this webinar, it'll take you to our schedule. And by scheduling through that app or through that online portal, you'll schedule just a phone consult with that one. By scheduling through that, we will give you this whole initial process that I just covered right here, which is typically $150 for only $47. Okay, this is a great opportunity for you to find out, hey, is this what's going on with my kid? Is this the missing piece that we've been looking for? Like, we've done everything, and it just doesn't feel like anything's sticking. Well, if that nervous system is bogged down, overwhelmed, is not going to be able to adapt to the things that we're throwing at it. So we need to do something different. We can't expect different, results if we don't do anything different. So we need to address that foundational component. So again, all of that, the phone consult, the neurological scans, the report of findings for only $47. So click on the link that was provided with you in the email. Go on there, schedule. Once you schedule, my team will reach out to you at the earliest time to walk you through getting the other appointments on the schedule and helping to get you answers for your child and for your family. So I want to thank you for taking the time to join me on this webinar. If there's, anything that you need, don't hesitate to reach out to us. But first, go to that link, click on it, schedule that first appointment, and we will then start to dive deeper and get more answers for what's going on with your kid and for your family. Have a great night.